Hello, everyone. My name is Dr. Mati Davis. I'm going to let people log on. I'm going to ask that all participants mute. We're just going to give it a few minutes for everybody to join us. Thank you so much for coming in. Good to see such a good turnout so far. And I'm just going to give it another minute or two. Welcome to everybody joining. It's good to see everybody log on. We're just giving people some time to join us, and then we'll get started in about a minute or two. Thank you so much for being here, everyone. All right, just one more minute or so. We're just going to let everybody log on. It's good to see people here and showing up. I love the city. Everybody showing up. Okay, we're going to go ahead and get started. Good evening. My name is Dr. Mati Davis, and I'm the Director of Health for the City of St. Louis. Welcome to the City of St. Louis Department of Health's Public Health Town Hall on monkeypox. I know that this is a topic that has many of you anxious, concerned, unhappy, quite frankly. And so it's my hope that we can get to the heart of a lot of topics. As always, you guys do a fantastic job of submitting questions up front. I think we have more than 50 questions that were submitted. We're going to get to as many of those as we can. So we are committed to engaging the community as we work on preventing public health issues that negatively impact our community and promote the well-being of people who live, work, and play in our great city. I took this role on in October, and you've seen me do at least 4 town halls now. I'm hoping to do a lot more of those in person, and I acknowledge the barrier to a lot of people in our community by them being virtual. Please know that we are planning some in neighborhoods, especially those where access is an issue. So it's a both and approach. It's so important to me and to this department that we have this discussion on the current monkeypox outbreak. After today's gathering, my hope and all of our hope is that we will have answered many of your questions with the most accurate, up-to-date information. Please also understand that this is an ever-evolving topic, and I don't think we did a good job of this as public health officials at the beginning of the COVID pandemic to make you understand that while information we give you may be pertinent now, it will continue to evolve and change over time. So again, we just ask that you are understanding of that and that you keep up with us for updates as they may arise. So I'd like to introduce my panel for this evening. We have a lot of great people here that are going to be joining us. So first and foremost, I'd like to introduce Nebu Colin-Cherry. He is the Director of Communicable Disease Response at the St. Louis County Department of Health. I wanted to introduce him first because it's important that you know that one of the things that's been important to me as the Director of Health is having a really close relationship with my partners in the county. I asked for them to meet with me monthly when I took this job. They've done that. We've done a lot of great things together since then, joint policies. So it's just so wonderful to see Nebu, who literally gets texts from me maybe daily at this point. So Nebu, do you want to unmute and say anything just by way of introduction?
Hi, folks. It's a pleasure to be here. And thank you, Dr. Mati, for that lovely introduction. Right back at you.
Right back at you, friend. Next, I have, anyone who's been to my town halls knows that I stand and love my staff so much. They make me look good, and so I love to show them off at every turn, and this is no exception. A panelist today is Tyrell Manning, who's a public health program specialist here. Also relatively new to the city, but hit the ground running and is a leader, fierce leader, advocate, lover of all things equity. I could go on and on about him, but he is here today because he just took the charge for our anti-stigma campaign, and I'm extraordinarily proud of him. So Tyrell, would you like to unmute and say hi to the people?
Hello, everybody. I'm excited to share space with you all tonight, and thank you, Dr. Mahdi, for that introduction. I'm always honored.
Last but certainly not least, one of the most vivacious, incredible leaders here at the health department, Valerie Newborn, who's a public health program supervisor, has been one of the leaders in our response to monkeypox, has led since we started announcing the first case here with a level head, with integrity, and again, with passion for the city. So Valerie, thanks for being here. Would you like to unmute and say hi to the people?
Hello, everyone. Thanks for joining us today. Hopefully we learned a lot of information. And thank you, Dr. Mahdi, for the introduction.
Awesome. So we will be monitoring the Q&A. Please use this feature to submit your questions. We also have pre-submitted questions that we will also use as prompts. And then lastly, we know what the hot topics are, so we're going to hit those early, specifically just general information. And then the big questions, what's going on with vaccines? So we'll be hitting those early and hopefully open up for dialogue as well. Thank you to our partners, STL TV, for being here. They will help us bring people to the front. I'd like to have people unmute wherever possible when they have a question. So I hate for this to be like an ongoing diatribe for me. So we will definitely try to make this as interactive as possible. Please remember, though, to be respectful of us and other attendees when speaking or communicating through the chat or Q&A. I will always make myself available. You can tell I'm still at work right now. This is my passion, my joy, this is what we love to do. But I do not tolerate disrespect in any way. So even if you don't agree with us or you're upset about something, I just ask that you keep all your questions and dialogue respectful. I actually don't even feel like I need to say that. All of the town halls have been incredible, even when during difficult times. You guys have been fantastic, not only to me, but to the Department of Health. So I thank you for that. So let's start with a little bit of background. I don't make assumptions that we all are in the same place of understanding where we are with this. So for those of you who know this information, bear with us. I want to just make sure that we have the same foundation for everyone who joins us tonight. So on May 17th, the Centers for Disease Control, otherwise known as the CDC, confirmed the first US monkeypox case of the current outbreak in Massachusetts. On July 23rd, the World Health Organization declared monkeypox a public health emergency of international concern. We in public health have been waiting for that for quite some time, because not only is it true, but it helps us to then be able to have access to resources in a timely fashion that are not always made available. And that's an important point when we start talking about what's happening with vaccines. On August 4th, the White House declared monkeypox a public health emergency. Again, something we've been waiting for and thankful to have, because it's going to help us to mobilize more quickly than we already have. The CDC said the declaration will provide resources and increase access to care. Clusters of the virus have been reported globally in 89 countries, 82 of which have historically not reported the disease. So this is an important point, because one of the big areas of misinformation and disinformation is, well, has anyone checked into the correlation between the COVID vaccine and monkeypox? And it's important to know that monkeypox has been endemic to multiple countries, is predominantly in Africa, for years and years, since the 70s, actually. And so this is not new. What's new is that it is spread and is now a public health threat across the world. And that's the reason for concern. I also use this as a placeholder to advocate for global equity, because once again, we show that until a disease affects high income countries, we don't really care about how it has affected for decades now impoverished and poor countries. So something that's top of mind for me, and I hope for many of you as well. Here in Missouri, however, reported its first case on June 18th and is currently reporting 21 confirmed cases. The city of St. Louis reported its first case on July 11th, and the city currently has 8 confirmed cases. There's a lot of information out there, and I hope our discussion this evening brings some clarity. So let's start with, what has the city of St. Louis done to date about the outbreak? So it's important that you know that the Department of Health has done quite a few things. Number one, we've produce a public service announcement, making sure that you guys have known what's happening in timely fashion. You can keep up with us. We do this in the press, we do this on social media, and we've been doing physical canvassing and outreach to communities, especially those that have been most affected to date. We've created a dedicated webpage for information about the disease. I'm going to ask Jasmine to put that in the chat so everyone can have access for it. That's at www.stlouis-mo.gov/monkeypox and another backslash. We've hosted a roundtable with LGBTQIA+ leaders and members in the community last Friday. It was incredible. It was only supposed to be an hour and some change, and we ended up going well over 2 hours. We also are doing this virtual town hall meeting on monkeypox, and I'm happy to do more as this evolves. We've initiated an anti-stigma campaign from the get-go. I'm really proud to say that not only has this become the standard for the region, but it's actually gained national momentum. Really being intentional about language that honors the reality and the facts of what is going on, but does not stigmatize or unfairly put communities that do not deserve to be unfairly associated with this in a negative way or in just an untrue way. We just will not stand for it. So we really want to be leaders, and we have been to date around anti-stigma. We have supplied monkeypox information in Spanish and English directly to partners to help local public health stakeholders assist in educating segments of the community. And realizing that coordinated efforts are the best way to fight these types of public health issues, the Department of Health and the county have come together on collaborative efforts specifically around vaccine distribution, which you'll hear more about. So now I'd like to introduce Tyrell, who has been the lead with the anti-stigma campaign. He's going to show you what information is out there that you can download directly from our website for your organizations, clinics, businesses, even at home with your children and family members. Tyrell, over to you.
Awesome. Thank you so much, Dr. Mahdi. So really, when we begin to kind of see numbers rising and the information that was going forth with monkeypox, we wanted to make sure here at the DOH that we were ahead of the game, that we centered anti-stigma and that we centered equity in those. And so I'll start with a little bit of grounding on just kind of the materials that we created and what that looked like for us. So we grounded ourselves, number one, in the needs of community, and just really listening to the calls that were coming in on our hotline and from leaders in community. And we wanted to make sure that these materials address their concerns and the needs of that community. We grounded ourselves in equity, working to make sure that the information was going to go to the most vulnerable populations, and it was done in multiple languages. Where, we have Spanish right now, but we are going to move forward and try to get these translated into other languages because we have multiple languages that exist in our city and the county and the city. And so wanted to make sure that we grounded ourselves in that equity. We grounded ourselves in combating and just the stigmatizing language and information and that misinformation that was going forth within community. So we wanted to make sure that everything that we put forth was backed by science. All the images that you see have been brought before everyone from Naboo, from Dr. Mahdi, Valerie, all of our staff and things have looked at it to make sure that we were doing and giving community the best information. We were grounded in also just developing images that were appealing and was relevant to community, using concise and clear messaging, and just really centralizing partnership and unity across the city and the county in particular. So making sure that on those images, you see that city logo and that county logo to kind of see that support between the two entities. And also making sure that we're very strategic in how we got this information out. And so wanted to make sure that we were going to the spaces where people were visiting and going to the FQHCs, to the federally qualified health centers, to spaces where community members gather that are most affected by monkeypox. And so we did very strategic, actually like getting in our cars, dropping them off, creating a Google Drive where community members that work very high level doing community work could actually access all of those images as we updated them, as we kept them, as we continue to update and create and make clearer language and things. And so with that, I'll show you a few of the images that we created. We started off, number one, with just making sure that we were very clear and fighting that stigma, fighting, and pushing back against the narrative of who, gets monkeypox, and understanding that everyone is, in the position to get monkeypox, right? Um, Wanting to make sure that we gave community information of where to seek support, where to seek testing, understanding simply how does it spread, putting very plain language in front of people. And then we move forward because I think we had a call where someone who was living with an immunodeficiency disease said, hey, what about, me? What about those of us who are living with immune, system issues and things? And so we said, let's create images and things for the immunocompromised. And so we sat down, gathered our knowledge, gathered our resources, and created these, and have also supplied these and made these accessible for community. And then we move forward, and we also made brochures and flyers that are very clear, very concise, that are also accessible on our website. If you go to the same website that Dr. Mahdi talked about, you can go there in the educational materials. You can print these off. We have them in English and Spanish, which I'll move forward to there's another one of our flyers. And then we also, I'll show you the translation of all of those images into Spanish. And so all of these are available for community. And we wanted to make sure that we got this information, again, directly to the people, that it reflected their needs and what they were asking for, that clarity to really kind of calm some of the fears and the misinformation that was going forth. And so we really wanted to center that information. And so those are some of the images. Again, I believe they just dropped the toolkit there for you all. Please access those, use those. We will continue to update those as we learn more, as we see shifts and changes, but we really wanted to get ahead of, not allowing misinformation to run rampant and cause more damage than good.
Thank you so much, Tyrell. And we'll keep those images up, but I wanted to point out a few things. Number one, I'll go over a few more about the actual risks and symptoms a little bit later. I do want to draw your attention to the chat that everyone has access to. You have access to the website link there, and you also have a website to the toolkit that has all of these resources available directly to our website in the chat right now. So please be copying and pasting those so that you have them and share widely. I'm big on misinformation and disinformation. You want to use trusted sources. While your WhatsApp group may be really interesting and a simple Google search is very easy, those are not vetted sources of information, right? So I want to be clear that the city and the county health department website should be your primary sources of information, along with the CDC. And again, I'll go over some of the actual details of this in a little bit later. But I know that the reason most people are here are for vaccines. So we're going to hand it over to Nebu to talk about the city and county's partnership around vaccine response at this time. Thanks so much, Nebu.
Thank you for having me. Hi, folks. So like Dr. Mahdi said, I'm Nebu Kolancherry. I'm the Director for Communicable Disease Response for the County Public Health Department. And as y'all know, there is a vaccine available for monkeypox. It's the same vaccine used for smallpox, because they're from the same family of viruses. Now, our strategy has been to make the best use of the resources available to us. So vaccine supply is limited. Missouri has been given a small allocation of vaccinations, and that's largely based on the number of cases in the region combined with the number of people that they think are most at higher risk. And so the combination of that makes for us to get a lower allocation than maybe bigger cities might like Chicago or New York. And given that, our priority has been to stretch that as much as possible and focus on the highest risk groups. And those are two groups of people. The first is close contacts to people who have monkeypox right now. So if you test positive for monkeypox in St. Louis, either my team or Valerie's team will reach out to you and do a case investigation. And a part of that case investigation is to ask you who your close contacts were. 9 times out of 10, these are sexual exposures or household contacts. And once we get those, we will reach out to those people and get them vaccinated, provided that they're within their window of exposure, which is up to 14 days. So that's the first bucket of folks. The second is, as of about a couple of days ago, we rolled out an expanded eligibility for vaccination that allows us to prioritize people that are at highest risk for contracting monkeypox right now in St. Louis, based on what we know about the epidemiology of monkeypox in the St. Louis region. And so that right now we're trying to prioritize men who have sex with men, who are the folks that are most affected during this current outbreak. And so the way to get the vaccination then is to go on either the county or the city website, and there is a survey available. And please fill out that survey, and many of you already have, and we're very grateful for you. And when an appointment becomes available, we'll reach out to you and get you vaccinated. The second way we're doing this is we're partnering with certain clinics in the region that are likely to see patients that meet the screening criteria, and then that way folks that get their regular care can talk to their provider as part of their appointment, as part of their sexual health care, and be screened and vaccinated that way as well. One more thing I want to touch on, there's been some recent developments as of last week where the FDA approved a different kind of vaccine administration called intradermal dosing. And what that means is it's a type of injection similar to what would happen when you get a test for tuberculosis. So it's that sort of shot that goes right under your skin in the forearm and causes that bubble to happen under your skin. And the great thing there is that the FDA has approved us to use less of the vaccine in order for that shot, because it's found to be just as effective. Actually, if anyone's interested, the studies from SLU, which I find it's great that, like, folks that are like, we're from the LU and we're proud. And so that allows us to stretch our vaccine much farther than we thought, which presents a huge opportunity for us. And both the city and the county, as well as the area departments, are working on implementing that strategy in order to vaccinate as many people as we can. I do want to say that the supply of vaccine that we have is far outpaced by the demand that we're seeing for the vaccine. And I know it's frustrating, especially when you get your friends in bigger cities that have bigger outbreaks, like telling you that they've got their shot. I understand that can be frustrating, but please know that your health departments are doing the best we can with the resources that are allotted to us. Did I miss anything?
You never miss anything, but you're a lot more polite than I am. So I just love that you put that so nicely. And then I'm going to come behind and make my team anxious about what I'm going to say. But I think those of you that have come to town halls know that I say it like it is, right? So the reality is, it is highly frustrating for you and for us in ways you cannot even fathom how frustrating it is for us that we are having to make these sort of decisions around a smaller pool of vaccines than we would like. The state is in a similar position, right? We have been in constant communication with the state, asking for more vaccines. They're doing the same. But the bottom line is, from the beginning of this, vaccine was just not ordered or not created in enough supply for every state to have the same. And in the beginning, the proportion was prioritized, were prioritized for cities that had higher case numbers, which means that based on our epidemiology, we just have gotten a smaller piece of the pot. From a public health perspective, for any of you who don't know my background, I'm an infectious diseases physician by training. I have a public health degree. It is maddening to those of us in this field and in public health that we even have to make plans in this way, especially after everything we learned from COVID. It is highly frustrating. In my meetings with the CDC and with certain White House task forces that have been convened, we are being reassured that they're doing everything they can to ramp up vaccine production so that we can expand who gets it. But the bottom line is, there just isn't enough for everyone. But one of the things that I'm getting a lot of is, why aren't you doing more? And please know, and let me be very clear in saying that not only have we been asking for vaccine for months now, we have come together with the county, we have brought in other advocates, I've been on the phone with congressmen and congresswomen. Today I was on the phone with HHS. We've had conversations with CDC. This is something we advocate for, but it just did not happen at the highest level. And the trickle down approach is what you're experiencing. My job, NABU's job, all of us in public health's job is to continue to advocate for that very strongly. So please know that we are not sitting here like, we think this is great. And we're so happy with the number of vaccines that are in the St. Louis region. We are not. But the fact that we even have this number, if I were to tell you how much vaccine we had 3 weeks ago compared to today, just know that you would be even more frustrated, and that it's taken a lot of work. And I have to give credit to NABU specifically, who has had a lot of long days, sleepless nights, and it has gone above and beyond to try to push this with a lot of our regional leaders. So I just want to make that clear from the onset. Like, we know this is messed up. We are advocating, and we're hoping that the Federal Reserve will open up and that there will be much more vaccine available for everyone. So thank you for that, NABU. NABU may have to leave a little later, so I'm going to actually ask specifically, a little earlier than the whole time that we have. So I'd like to ask if there's questions specifically about vaccine distribution, the vaccine itself, that we kind of open it up right now before we go on with the program. So if there are people in the Q&A, I don't see anything vaccine specific right now. Sarah is asking, when you refer to the amount of vaccine the region has received, is 1,900 doses still accurate? NABU?
The total amount, yes, but we're using it up. So is that the current number? I don't think so. No, so it's not. But,
yeah. So Sarah, that is the initial allotment that we got that we're working from, and we are moving to, and we've already started using it, so it's not the current number, as NABU said. Ryan says, is one dose enough to protect you?
Great question. So this is a 2-dose shot. So with the new FDA guidance, if it's subcutaneous, which means if it's a regular shot that goes into your arm, it's a 1 full dose that is given on day 1, and then 4 weeks later you get your second dose. The same goes for the other option I mentioned, the intradermal shot, which goes in your forearm. I imagine the reason for this question is you're hearing other jurisdictions use 1 dose as a strategy to make the vaccine go further. In Missouri, we're following the 2-dose strategy, and that's for the state and federal guidelines.
And then there's a question about, is previous vaccine against smallpox protective? This is where I love these questions. They speak to my nerd ID heart, but we can definitely tag team these, NABU. Of course, if you have previously been vaccinated about smallpox, you do have some level of protection, but at this stage, it's not going to be maximally protective. And so we encourage that when the opportunity is available for folks to have it, that you go ahead and get it. You should not feel that because you had it at some point. Most people have it during childhood, and some people maybe for travel or whatever reason, that you should feel like that is enough at this time. Other questions that I'm seeing: what can local elected officials do to expand capacity for vaccinations in public education? I love that question, so I'm going to address this right now. I've had a lot of people sort of criticize, and people who work with me know I have low tolerance for couch criticizers. I have great respect for people who have productive questions, who hold us accountable. But I also think that people who are in a position to help, I rarely get people actually reaching out. Our website has the email address that gets to me directly. And so I always welcome those. And I've been really, really happy to see so many people do that in a productive way. So what I will say is this: if you have connections with the state, specifically around public health, or with the CDC and any other federal leaders, I think advocacy is key. There are no organized ways that I've seen, for example, like mass letters from the public and things of that nature. So I can have my team look into that. But I'll tell you that I've been dealing, I have a call out to Congresswoman Bush. We've been dealing with HHS. Like I said, DHSS have been incredible and have always answered our calls and have really worked with our hub, our region, to expand the number of vaccines. Like I said, we had very few compared to what we have now, and that's largely in part because the state has been wanting to work with us. So I just really think, continuing to engage. I see a lot of aldermen and women on the call. Thank you for being here. You always show up for us, and I'm incredibly grateful to have you as partners. You will continue to get updates from me specifically. We have one coming to you on Thursday around this, and opportunities to partner as they arise. The reality, though, is that we can't partner with everyone because with limited doses of vaccines, it's just not feasible. So once the numbers increase, please believe we want to work with everyone. But right now, I think it can become from a public health perspective, it can become very confusing and quite frankly frustrating if we give everyone every partner in the region 5 doses of vaccines, and you think that that's a place that you can go to get vaccine, as opposed to, and from a monitoring and evaluation perspective, that can become really difficult. Can you explain why the manufacturer has reservations about not using the full dose of vaccine? Nebu, I see you nodding your head, so I'll let you take it first, and then I can come through too.
Yeah, it's not the manufacturer. It's the fact that there's been intradermal dosing is another common way of injection. And in the study that I said that they did at SLU, they found that it gave a similar immune response. And so the FDA has essentially opened the doors to allow us to use the lower dose in a different method of injection in order to increase the number of people that we can vaccinate. Go for it, Mike.
No, I think that's absolutely right. I mean, I wouldn't add anything more to that. What is the anticipated timing for new production to be available and distributed? So the Biden-Harris administration has, as recently as August 15th, so yesterday, put out a release, and I will put this in the chat for everybody to have access to, because it's really hard to know where to access this a lot of the time. I don't know how to work the chat, so I'm going to give this to my staff, and can you put this in the group chat? But this is this is the release that came out from HHS. The Biden-Harris administration announced yesterday that it's making up to 442,000 doses of the vaccine available for states and jurisdiction under an accelerated phase 3 to combat monkeypox. So if you read this press conference, it walks you through how they're planning to do that. So already they have just released just under 500,000 doses through an accelerated course. So we're hoping that we'll see a lot more vaccines come out, but we can't assure you that the proportions that they're using right now for different states won't be the same. And that, again, you'll see a lot more in New York and San Francisco and in Chicago as compared to here in Missouri. Will the vaccine be mandatory? Are we headed towards lockdown like we saw with COVID? It's too early to tell. There's no indication that that's the case. I'm always honest with people that if we don't act fast, we definitely will, right? You want to get ahead of something once it's been declared a public health emergency, both globally and here in the United States. What we do over the next month or two is really going to determine how this becomes. And I say this as someone who just immediately could not even believe that this was reality after 2.5 years of dealing with COVID. I think for many of us, our mental health, for parents, I've got a 5-year-old and a 2-year-old, just even thinking about keeping kids home, it's really scary. So what I tell people is stay calm, don't get ahead of yourselves. Let's do the best we can with what we have. And we will continue to do the best we can by you. Sarah, I answered your question. Are there many more doses coming that you know for sure about, or are you still waiting on the feds? Always waiting on the feds, Sarah. That's the key. But I put the press release is in the chat for all of you to read about what the White House said about this yesterday. I'm going to stop here, and we're going to save some of the rest of the questions that you guys are putting for the end, because I was doing this just so that Nebu would be available for questions in case he had to jump off. While we will get to the rest of the questions throughout, but we're going to move on to talking a little bit about just teaching people some education about symptoms and risks and things of that nature, and then it's all Q&A from there onwards. So we're going to move on to that part. So let's talk a little bit about just the easy, what is monkeypox? So monkeypox is a zoonotic virus. It's a rare disease caused by the actual virus that's also called monkeypox, which is from the family of orthopox viruses. The virus is part of the same family of viruses as variola, the virus that causes smallpox, which is why the vaccine crosses over and is effective here as well. Monkeypox symptoms are similar to smallpox symptoms, but milder usually, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox, which is what we get asked a lot of as well. So next I want to answer the question, how does monkeypox spread? So monkeypox is spread through direct contact with an infectious rash, scab, or other bodily fluids. So it's important to say that even though we are seeing it affect certain populations more predominantly right now, we are seeing it can affect everyone, right? Because if I tell you that it's spread through direct contact with an infectious rash, scabs, or body fluids, anyone can be affected, right? It can also be spread through respiratory secretions during prolonged face-to-face contact or during intimate physical contact, such as kissing, cuddling, or sex. So it's the prolonged nature that makes it more commonly spread through sexual contact. It is not a sexually transmitted infection. That's been a lot of confusion. So we see it spread the most through sexual contact because of that direct contact, because of the ability to rub up against a rash or swap those respiratory fluids, and you have more time to do so because you're engaging in the activity much longer, right? You can get it through touching objects, fabrics such as clothing or linens that are previously touched by the rash, or body fluids of someone who has a monkeypox. You can get it through being scratched or bitten by an infected animal. You may have seen the press release yesterday, yesterday or the day before, I can't remember, around the first animal dog that got monkeypox from a human. So we know that that's possible. Monkeypox causes a rash. It can spread from the time symptoms start until the time the rash is fully healed and a fresh layer of skin is formed. This can take several weeks. Monkeypox, again, can be acquired by all people regardless of gender, identity, or sexual orientation. But epidemiologically, we are seeing the vast number of predominant cases right now amongst men, and specifically men who have sex with other men. So we will now address the next question. So who's most at risk for getting monkeypox? So like I said, I think we've addressed that, right? We know that it's important that anyone can catch it, but right now the CDC is reporting that predominantly the number of cases are predominantly in men, specifically in men who have sex with men, and also we are now seeing in states that have the highest number of cases that they are most likely seen in minoritized communities, so Black and Brown communities as well. Should people be concerned about going to crowded events? Again, this is not, I think I've described this in such a way that you guys understand this, but it's important for us to be clear. Wait a minute, did my head rep just give up on me in the middle of the town hall? Awesome, sure did, folks. I'm just gonna fix that and get it right back up. So should people be concerned about attending crowded events? No, right? Because there's ways for you to protect yourself. You now know that it's close contact, it's rubbing up, it's respiratory close contact. So if you're in a crowded space, you want to make sure that you have, again, I don't want to get people triggered or anxious by using the term socially distancing, but social distancing is back in effect here, that it can help to not be in close contact for long periods of time. So early indications right now are that events with activities in which people can engage in close sustained skin-to-skin contact, that's close sustained is the key, is where transmission occurs. So if you plan to attend an event, just consider how much close personal skin-to-skin contact is likely to occur. What are the highest risk settings? Oh, go ahead, Mabel.
I also want to talk about, for the previous question, right? I think like harm reduction and risk reduction is important. So if you're attending an event where like it's like a dancing with minimal clothing, for example, that's something you want to be aware of. And if the disease spreads through skin to skin contact, wearing, having more clothes will prevent that. Just wanted to say that. Thanks.
Thank you. That's why you're here. That's why I love working with you. So we're going to talk about, so we talked about the city's plan to vaccinate individuals. And so I do want to go back to the Q&A now, and we'll work through those. I'd like to, I'm just telling this to the folks that are helping me to direct questions. I'd like to hear from folks. So I'm going to try to bring people up so we can hear your voice and actually have dialogue as we go through questions. So please submit questions to the Q&A portion, and we'll try to get through them. So someone said, where and how do you get tested? So Valerie, this is your time to shine, my love. Can you talk to the folks about where and how we can get tested?
Absolutely. So there are several places you can go and get tested. One of the main places you can go is by contacting your local, contacting your primary care doctor, your primary care physician. They can also submit testing through a commercial lab. So you can contact them and they can perform testing in their office, hopefully, but contact your primary care doctor. They will be able to help you with that. If you do not have a primary care doctor, we have other locations that you can go and get tested and also establish care with. One, you can go to Total Access Urgent Care. They also offer testing there. SLU Hospital and Barnes Hospital also does testing in WashU. So you can go there as well. You can also go to Athenia Urgent Care. They also do testing, and then a clinic also offer testing if you are a current patient. And then we also have Southampton Healthcare that also does testing as well, if you are a current patient with them. And then we also have a list of other locations that is also located on our website that you can see for testing under testing information. So you can go there, and then the county has their also a list of testing sites as well. And Nabu can help you with that for the individuals that does live closer to the county area.
Yeah, thanks, Valerie. So our sort of perspective is the same. It's go get tested wherever you get your care. Because testing is available through most commercial labs, just about every provider does have the ability to test for monkeypox. But if you are concerned, call ahead, and if they don't have it, you know, the same applies. Urgent cares, FQHCs, et cetera. If cost is an issue or insurance is concerned, please call the health department, and we will work with you to see to connect you to testing. Madi,
Yes,
is it okay? Oh.
Yep, I'm sorry. And if you guys need any like help guidance on where to find these locations, you definitely can call our hotline, our communicable disease hotline, and staff will be able to help you and direct you to the proper locations to help get you testing. Just so you know, we want to make sure everybody gets tested fast and efficient. So if you need help with that, you can always reach us.
Thank you. So Gary Hosna, you available? And please can STL-TV bring Gary forward so that we can make sure we hear from you and also answer your question. But while we're bringing Gary forward and unmuting Gary, Gary asks, hi, Gary, you can unmute at any time. I have completed the online, actually, I'm not going to read the question. You can speak for yourself, Gary. Do you want to ask your question?
Yeah, sure. I have a couple of questions
Okay.
Related to the distribution of the new production of the samples and the amount of doses that are going to be made available weekly. Is there going to be some updates associated with those? And the other question is in regards to a large event and the eligibility if you're going to a large event.
Okay, so let's start with the first one. And I'm going to ask Nebu, I think it would be helpful to talk a little bit about what happens after people get the form, like sign the form. So Gary, ask this, and I think it will help with the first part of your question. So you said, I've completed the online eligibility form. When can I expect a contact to confirm or deny a vaccination? And that will tie into like, where are the doses? How do we know where we can go and get them once we've done that? So can you walk people through that, Nebu?
Absolutely. So once, you know, thank you for filling out the form. Once you have, we will make sure that essentially the short answer is we'll contact you when we have an appointment available, right? And again, I say that with a caveat that the supply is vastly outpaced by our demand, and so I apologize in advance for you having to wait, depending on where I think as far as I'm concerned, it's going to be like roughly a first come, first serve, as long as folks meet the criteria. And depending on when you fill that out, it may take some time.
And Gary, to be honest, and you're still unmuted, so feel free to engage here, but to be honest, this could be very frustrating because we saw this at the beginning of the COVID vaccine, right? Where people were signing up. You may not hear for weeks. That silence is really frustrating, but with a limited number of doses, we can only go on a first come, first serve, and if it meets the eligibility that's been given to us by state. One of the things we're advocating against is to stop this criteria. It's incredibly stigmatizing. It causes a lot of issues for many communities. But again, we want this to get to everyone. So the short answer is you're going to apply through an eligibility form on a first come, first serve basis. We'll get in touch with people and let them know where we can go. Shortly, you'll also get information on both the city and the county's website that lets you know where these other clinics that have availability are, and they'll be working on a similar protocol. It's not a great way to do it, Gary, because we wouldn't have to do this if we had all the vaccines we wanted, but does it at least answer the first part of your question?
Yes, it does.
Okay,
So
great.
the portion of that plan is there at this time, there's no plan to do mass vaccination events like other cities have done. So there's
we can't. With 1900, there's just no way, because you have to think, even with those 1900, we have to save some for people who actually become close contacts of people with of monkeypox. We can't put them in a position where we've run out of vaccine and close contacts can't get vaccinated. They need to be protected right away. And with 1900, there's no way you could do a mass event right now. Once we get more doses from the state, and with the White House's announcement yesterday, I'm hoping that's forthcoming in the next couple of weeks. We've already reached out to partners who have a track record of success with mass vaccination events for COVID, for example, that we're ready to work with. That's just not a reality right now with the number of doses we have.
Right. And then the last question is more about the potential exposure. So consider a large crowded event that you did mention with close contact, crowds, parades, the shirtless dancing you kind of mentioned before. When you talk about contact in an event like that, and distancing, if you were to engage in that, what would be timing associated with that? Is it, hey, shouldn't really be in that type of place or close contact for more than an hour, or is it, just I'm just trying to understand.
Yeah, it's so hard to allocate an actual time, right? So if you cannot be, so number one, our epi is not as high as other cities. We know that. So we do not think that this is rampant throughout the city and the county to the extent that we're going to start telling people not to engage in activities. So then it's really about self-regulation, right? So if you do not have a certain degree of comfort that you will be at an event where you cannot control skin to skin or other close contact like that for a sustained period of time, that's difficult. There's no study that says that it is this amount of time where the sustained contact has, because there's other variables, right? Like, are you even touching in sustained contact with someone who has monkeypox? Are they actively infectious right now to where they can transmit it? There's no way of knowing. So public health is about giving you the available information about what risk of transmission looks like, and you making the best decision for yourself and your family about what level of risk you're willing to take. It's not a great answer, Gary, but there is no study that would ever say to you, this is how long sustained contact is for getting monkeypox.
Perfect. Thank you.
Thanks, Gary.
Dr. Manning, that was a part 2 to that question. So it looks like somebody asked that question in the chat, but they also about the crowd going to the parade, but they also said, am I eligible for a vaccine?
Can I speak to that?
Yeah, go ahead.
So we, I've been getting a lot of questions like this. I want to go X place. I want to do this. Can I get a shot? And again, so like I said, given our supply, our strategy is to reach people that are at highest risk. And unfortunately, at this time, we're not able to offer truly, that's called pre-exposure prophylaxis, and we're not able to offer that right now. And so I'm sorry, and no.
Yeah, it sucks. We're all mad about it. We're not happy as public health leaders. It's honestly just incredible to me that we're even in this position. And yet I'm happy that the level of advocacy that we have shown thus far has yielded results already. So I'm hopeful that we'll see a lot more vaccine product come through in the coming weeks. Someone asked, can you receive meningitis vaccine within 4 weeks of getting the monkeypox vaccine? And that was Adam Gueldner, Gueldener. I'm sorry for butchering people's names. Can we bring Adam up? And firstly, I just want to commend Adam for yet another great infectious disease nerdy question that makes my heart happy. So Adam, I'll be honest with you that if you were to go on, if you were to go to what I call trusted sources right now, they're not going to give you a list of vaccines for which things are safe within. But in general, there has been no identified strict contraindication for getting the meningitis vaccine within the 4 weeks. But I don't like speaking out of turn. So my mentors, I did my fellowship at WashU, so I get to cheat and talk to all my mentors whenever I have a really good question. So I'm gonna ask them about that right now. When we were dealing with COVID, we dealt with this early on, where we had to kind of wait to see. So it was the question with the flu vaccine and COVID, and we just needed experiential data before we could say anything that was fair. With monkeypox, we've had a lot more experience with it. It's not like it's a new vaccine. So from my ID days, I don't remember a true contraindication, but I would actually like to follow up. So if you could send me in a private chat your email address, you'll get an email from me tomorrow after I've talked to my faves in the ID world. But Adam, does that help? And where did that question come from? And let's nerd out together.
I was able to get my first shot in Chicago when I was up there, and just recently went to the doctor, and they mentioned the meningitis vaccine. It had been 7 years since I got it.
Yeah.
So they had already pulled the shot out of the vial, and
you were like, is this cool?
I thought about it, and I was like, oh wait, should I do this or not?
Yeah.
And I did it. It had been about 3 weeks since my first vaccine, so
there is no contraindication from my infectious diseases fellowship days, and certainly from when I was in practice as early as last year in September, and doing a lot of travel vaccines, a lot of vaccine updates for folks with meningitis vaccines. No contraindication that I'm aware of, but I don't like to say things that I'm not 100% confident in. So once I check with my immunization expert and mentor over at WashU, I'll email you tomorrow.
Okay,
so just
thank you.
Send me your email in the chat. Did you have any other questions before we moved on?
Yeah, my other one was, what did I put?
You wanted to know if we can get tested without lesions.
Yeah.
Can you
Currently,
get tested?
are you without lesions?
So there's a lot of criteria around testing. Actually, Nebu, I want to take full advantage of you before you go. Let's talk a little bit about criteria for testing right now. And I'll let you take this because I know you guys have been doing a lot of this in your clinics at the county. Go ahead, Nebu.
Yeah, thank you. I was really hoping someone would ask this question. So if there's any clinicians on the line, our message to all clinicians has been add monkeypox to the differential. And what that means is it is one of the many possibilities that a disease could be. So to answer the question, do you need lesions to test? At this time, yes. The only exception to that is something called Can I talk about proctitis on this? Yeah. The only exception to that is proctitis. Proctitis is a fancy Latin way of saying inflammation of the rectum. And so that in about 5% of cases, that's actually the only symptom that we see. And in that case, rectal swabs have been taken. Meaning, so there's not lesions on the outside of the body. The assumption is that there's lesions inside the rectum. All other tests, you need to have a lesion. You need to have a test. Actually, let me see if I can find a test. Oh, look at this, show and tell.
Oh, come through with the show and tell, Nebu.
This is why I have no life. So let's talk about what the test is. It's literally these two things. So this is a swab. This is a sterile tube. If there's a lesion, it's a physician will take a swab your lesion, put it in this tube. So at this time, unfortunately, it's kind of like the early days of COVID. You do need a lesion to get a test. Now, that
Now, if you have a spot coming in and it's in a very early stage and it hasn't yet come open, will they open a lesion to then test the fluid inside?
That's a great question, Adam. So one of the things that's really important, because again, the public gets into a frenzy, and I can't tell you how many people have just sent me pictures. I think is really inappropriate. Stop taking pictures of people in public. It's not okay. It's not cool.
Oh, yeah,
I have
not
gotten a lot on my phone of people taking pictures of people at dinner, at Walmart. Not okay. But
Yeah.
It's like anything else in medicine, right? We're not just going to be like, you have a rash, let's swab. Having said that, we're trying to make people understand that swabbing for this is actually very simple. So we're not going to stop ourselves from swabbing, but we're only going to do it with a reasonable level of suspicion, right? And that takes a full history and physical into account, a full story that makes for a good case. So what a good clinician is not just going to be like, oh, you have a rash? I can pop that pimple, let's swab it and send it off for monkeypox. There's no reason, right? It depends on the rest of the story, right? Do you have the risk that we talk about? Are you a close contact? Do you have reasons to believe that you are in sustained contact with other folks? Does the rash look like the rash that we know for monkeypox? And those of us who do this work, and even people who are outside of infectious diseases are very qualified to do this. We've been really great about making sure people have a lot of representative pictures around what the different types, how the rashes can present, being really sensitive to the fact that they can present in different ways from people with different skin colors and backgrounds. So it's not just going to be you have a rash, let's swab, but we can easily test as long as the whole story when we meet that person makes sense to do it. Does that make sense, Adam?
Yep.
Great. Thanks for coming up and for these great questions. We're going to move on. And
Okay.
I'm going to be a little cheeky and bring up someone who works for me and asked a great question. If Matt Haslam is still on the call. Matt, you're going to ask a question in Q&A. I'm going to make you come up, Matt. So I don't know if Matt is still here, but if Matt Haslam is still up, please let's bring him forward.
He's been brought forward. He should be able to.
Hi,
unmute.
Matt. Would you like to ask your question? Because I think it's great. Maybe he had to step away, but I'll read his question. He says, are the feds rapidly spinning up production to meet demand, and have they used similar legal strategies as COVID, like the Defense Production Act, to work with manufacturers? Fantastic question. What most of us are like, we have this blueprint. Are we using it? If not, why not? I have not heard anything about the Defense Production Act yet, but you can look at the press release that came out yesterday. So production definitely being ramped up. Whether or not they've gone into the Defense Production Act, I have not seen equivocally yet. Have you, Nebu, or any of my other panelists? Okay, good. No. Okay, Matt, you got away with me not making you say your voice, but it was a good question nonetheless. Carol says the confusion about the increase in number of immunizations from a vial is going to be hard to combat. I agree with you, Carol, but we have to, it's our job. It's my job as the health director. It's our job in public health to continuously be thinking about ways to be clear and good about information. But I agree with you that that can be a really confusing one. Michael Voss, who is in the healthcare community, asked a really great question. Michael, can we bring Michael up? And I'd also like to bring Katie Erker Lynch up, a leader, an advocate, an ally, someone who's held me responsible in a really productive way and who I respect greatly. So if we could bring Katie Erker Lynch up. Michelle, would you like to say your question? I'm sorry, I said Michael, but it clearly says Michelle. I'm tired. Michelle, whenever you're ready, you can unmute. All right, people don't want to talk, or they're busy doing other things, which is their God-given right. If you have had a smallpox vaccine, should you have a titer done before getting another smallpox vaccine in the designated group to receive a vaccine? So if you're, oh, Michelle, hi.
Can you hear me?
Yeah, hi.
Oh, okay, thank you.
Are you a nurse hero?
I'm a nurse and I work with Valerie.
Oh, it's my Michelle. Hello. Thank you so much for coming up and asking that great question. I read it out, but where did this question come from? What makes you ask this question?
Because sometimes we do titers with other things, and so I was just wondering about this.
Yeah, we do not need to do titers at this time. especially not if, you know, you had a childhood smallpox vaccine or one of that nature. We certainly don't. There's no indication for getting titers at this time. Nebu, have you seen any exceptions that I'm not aware of? No. So we're not doing titers in any way, but thanks for asking that question.
Thank you.
And then
In
it's
fact,
Katie.
I'm sorry. In fact, Dr. Mahdi, they actually is recommending that they do get boosters for previous vaccinated individuals that were vaccinated with smallpox.
That is true. Were we able to get Katie up? And if so, can we? I'm about to ask Katie's question.
I think she may have left Zoom.
Did she leave? Okay, so I'm going to read it out. She said, I'm glad to hear that you are happy with DHS's response. Do you think that St. Louisans should apply pressure to the federal government to increase their response to be more robust? Yes, I think we should always be holding, you know, you guys hold me accountable and I'm fine with that. We should be holding the federal government. I do not believe we have adequate vaccine supply yet. I'm glad to see that they're being really responsive and communicative about their efforts, but we need to continue to apply positive pressure to get them up. So my answer is always yes, yes, yes. Just Ryan can be brought up. I don't see a last name. If the efficacy of the current smallpox vaccine is only 80%, are there efforts underway to develop a vaccine specific to monkeypox? Ryan, that's a great question. The only thing I will say is saying only 80% efficacy, I don't think is great. Like, I think people in the community think of 80% and think about like passing a test and 100% is the goal. But a lot of the vaccines that we give you, including the flu vaccine that's really impactful and has prevented a lot of severe illness and death, are 50 to 65, sometimes depending on the year and how that vaccine is doing percent effective. So to have something that's 80% is incredible. So let's start there. But your point is still incredibly valid in that we would like to see, and there's a lot of people, including researchers at our very own academic institutions right here in St. Louis, are doing research into vaccines that may be more specific to monkeypox and that may increase the supply here locally and globally. Ryan, would you like to unmute? Did that answer your question? Did you have any follow-up questions, Ryan?
No, I think you covered them. Thank you.
No, you're welcome. You guys are very nice tonight. Nobody's
Mahdi, can I also clarify that? So that there's two types of vaccines available. The one that we're using, which is called Jynneos, is actually, it literally on the box, it says for monkeypox and smallpox. So it is created for this purpose.
And so again, there's a range. I think people think there's only the smallpox ones, but if you're thinking about any others that have a higher level of specificity to increase that efficacy and to provide a wider range of vaccines like we did in COVID, yes, those studies are underway. Oh, Virginia, this is such a great question. I hope Virginia is still here. If we could bring Virginia up and unmute. Virginia is a school nurse and wants to talk about my recommendations for COVID-like precautions for monkeypox upcoming. So if Virginia's around, would love to bring you up. That's a fantastic question. First of all, to you, Virginia, to Michelle, to all our other nurses, thank you so much. You are the heroes of the current pandemic for healthcare in general, and you take care of so many of us, especially you working with schools. I just want to thank you so much for all your work.
Oh, you're welcome. Can you hear me okay?
Yeah, I can hear you. So talk to me about your
Perfect.
question and why it's so important for us to address this right now.
Yes, ma'am. So we work with Valerie very closely as a school population on how to control COVID, how we navigated to protect our students and staff. And so now we're sitting around saying COVID precautions are starting to be like the thing of yesterday, but now monkeypox is a thing. How do we keep our students and staff safe? Do we start bringing all the precautions back that we did with COVID? If this is like a high contact stuff, like does monkeypox live on surfaces for a long time? How do we help, especially like our daycare and pre-K kids who do everything together, swap milks and like lay on each other? How do we keep them safe, especially?
I can't thank you enough for bringing this up, because you can't imagine how hard it is for school leaders right now. So I want to be clear that for me, it's been really important to have an open line of communication with leadership in the school. I have a weekly meeting with them and have since I took this role through COVID and now through monkeypox. Schools have to start coming up with policy a lot earlier than when kids start. And we know that people are starting school even this week and most people next week. And it's so hard because we're still very much in a pandemic. and yet we now have monkeypox to contend with. And unfortunately, we haven't been given school-specific guidance for monkeypox, but Suzanne Alexander, who is on a well-deserved vacation, so can't be with us today, and Valerie have been working on policies for COVID and for monkeypox for schools specifically. So we updated the school ones, and as luck would have it, the moment we updated it, the CDC made a new change. So we're getting updated guidance to schools as early as tomorrow. And then for monkeypox, we're hoping to get very preliminary guidance. I don't like sending guidance out that gives people a false sense of security that this is the way it's going to be. Without actual guidance from the CDC, it could look a lot different. But what we've done is use what we know now about the risk strategies and what we also know from their guidance that the CDC does have about congregate settings, which is very similar to schools. But we don't know where they're going to land, especially with isolation and quarantine, for example, for children in schools, just because it's a lot, it's a longer time that people potentially have to be under isolation and quarantine, and it could cause a lot of disruption. So they may have preliminary data. So how the CDC gets data that nobody else may have access to is because they're the CDC. And so when something is becoming an imminent threat, they have what they call data hubs around the country where they can get clusters of information to make informed decisions. So while it's not the huge randomized clinical trial that can give you like really high degrees of specificity and accuracy, maybe it can really help them with preliminary guidance. And again, we're going to be much better than we were with COVID, where at the beginning of any public health threat, things are going to change and move. So guidance today may look different from guidance next week, next month, and months from now as we're learning about something. So we're doing the best we can. So Virginia, to answer your question very long-windedly, you guys are going to get, at least from the city, 2 different policies for schools that will, and Nebu and Kate and I are constantly chatting and talking, so they get what I have, I get what they have, and so everyone will have access to this. But it will be guidance around what we say is guidance for schools. We're very clear at this stage in the COVID pandemic, at least, that it's not a one-size-fits-all for schools, because different schools have different resources and capacity for things like having their own at-home antigen test kits, the ability to social distance, have high-level ventilation. So we work with them to then build their own policies. That's how we've been doing it here at the city. And so the same will be true for monkeypox, as we'll get that guidance out. Is it going to make it really difficult for schools? You betcha. It's a challenging time to be dealing with COVID and monkeypox at the same time. But I genuinely believe that with monkeypox, at least, some of the things that we can do are very simple to help protect kids. And if we're able to do that consistently, my hope is that this will not be nearly as bad as we may think it is. Virginia, does that help answer your questions? And do you have any further comments or follow-up questions?
No, it was very informative, and kind of I just needed to hear that. I meet with our school tomorrow, and so we're just trying to, I will wait. Valerie worked with my school very closely, so I look for the communication to come out, and we'll
Valerie great? I just don't know how she has the same 24 hours. She's like in constant communications with the schools, and her and Suzanne, like everybody has been like, I work with Valerie, I work with, it's fantastic. And so it's good. This is why I bring my staff up, because sometimes you guys can be frustrated at home, feeling like no one's working for you and on behalf of you at the city, but there's a lot of work happening that you just may not be aware of. So I'm glad that people come to these town halls and become educated. And again, thank you for all your work with schools. It's 7:09. I'm probably going to give us another, 10, 15 minutes for those who want to stay on. Some people have already dropped off because #Tuesday, it's been a long night so far, but thanks for hanging with us. If you have, let's continue to go through the Q&A. Keith Rose, would you like to come up, and can we bring Keith Rose up? Keith is talking about quarantine and isolation protocol. What kinds of financial or other support services are available to community members who are unable to work or leave their homes? Fantastic questions, Keith. Thank you for asking. Are you unmuted, and would you like to say more context around that, or where that comes from? Because I think it's a great question.
Yeah, so my understanding is that the isolation is a little bit longer than with COVID. And also because we didn't have something like the CARES Act, I don't know if people are going to have the same kind of support with loss of income that we saw during the beginning of the pandemic. And so I'm wondering how is someone going to be able to navigate that, especially because we know so many of our queer and trans community members don't have the kind of stable salaried jobs that they could work from home. And
Yep.
so they're going to be extra impacted by this.
Whew, I love this question so much because it gives me an opportunity to really educate folks about what public health departments, local ones, can and cannot do. So let me speak for the city. The first thing is that we get a budget every year, and that budget has specific line items that, hold on one second, please. So we have specific line items that we cannot veer from. Like, we get audited, we can't just reallocate funds because we need to. So when a public health threat occurs, like the one that we're dealing with now, we have to wait for the local government to allocate federal funds for assistance. Otherwise, there just isn't pockets of cash that are available, right? Even if it's completely reasonable to me to say, this is the current public health threat, I should be able to take my budget and reallocate dollars to this. When we get audited, we will lose those monies in the future. There are rules and regulations that prevent us from doing anything. So the first thing is that we need those federal dollars to get opened up immediately, so that we can help people who need it. Because like you said, we're already seeing that this is disproportionately impacting minoritized communities, our LGBTQIA+ community, and they need resources now, right? So my hope is that in learning from COVID, the federal government's already looking at a similar system like ARPA dollars that we use throughout COVID to help assist people and to help us partner with people, get organizations that are already trusted messengers that have earned the trust of the communities, because we know that hospitals, health departments have a long history of valid mistrust in communities. And so we need to get those funds out to people, especially in the LGBTQIA+ communities, which are the leaders that they trust and that they can work with to get those funds. Unfortunately, those haven't been given to us now. My hope is that that's thought about very proactively up front. So there was that. What else did you ask, Keith? Because you asked there was so many good components to your question.
I also asked a little bit more about how the isolation and quarantine protocol COVID.
Nebu, do you want to talk a little bit about isolation and quarantine for now? And then we can kind of talk about where it may or may not be headed.
Yeah, and I'm happy to set you up for that too. Really quickly, I think definitions are important here. Isolation is something that you do when you have the disease. Quarantine is something that you do when you're exposed to the disease. At this time, there is no quarantine for monkeypox. So if you're exposed to the disease, our hope is that you can get vaccinated, right? Because there is a vaccine available for close contacts, and that is truly close contacts. So it would be right now for us, for the most part, it's household contacts as well as sexual partners. And there is no other quarantine requirement if you're exposed. If you have the disease, meaning you test positive, the isolation is a little, it's not a set number of days. What it is until the lesions crust over and scabs are formed and new skin forms underneath your lesions. So I know that's not a set number of days, but in most cases, that's anywhere from 2 to 4 weeks. And that's what Keith is referring to when he says that the isolation is longer for monkeypox than it is for COVID. Now, Madi, I don't know how you want to take this, but we understand that that is untenable for some folks, and so does the CDC. So the guidelines released today are actually they talk about this in a harm reduction way. So as public health professionals, we are asked that, we have to say that is the official guidance, at least as of right now, for the CDC, and hopefully we'll, as more is known about this disease, right, we're coming from a point of uncertainty, we'll let you know. But there's also like the basic harm reduction person in me that says, if you mask, again, so this disease is spread through skin-to-skin contact with lesions and respiratory. So if you mask and you cover your lesion with your clothes, that is that much less likely for you to transmit the disease. And I just wanted to name that with the caveat that more is we're learning more, and we'll communicate more when we have it. But as of right now, that is the guidance.
Thanks, Nebu. Does that help, Keith?
It does. It does. Other than like financial support, direct financial support, are there any kinds of services for like delivering food or things like that that will be made available to people who are isolating?
I actually love that suggestion. I hadn't thought about trying to, get specifically food services. But I learned, this is why I love engaging with the public. So that's fantastic. One of the things that I think we're going to add to our monkeypox website, because we're building and we're constantly evolving it, is resources that are already available through the city and the county, as well. So if you're the sort of person, where can you get help with utilities anyway? Where can you get help with rental assistance? Where can you get help with now food insecurity? Because I love that suggestion, but specifically partnering to go. And I'm creating a list of asks from folks that I know have all of the money, very rich places like, our academic hospitals and other places that have great grant money and may have the ability to kind of partner with us to provide this funding where we may not have it through local health departments quite yet. And I think that it would be great to utilize those places that come to me and say, how can we help? And I'm like, you know what? We're going to try to have an active list of people who are in isolation and make sure that we can get them support services while we can, right? Because if this thing gets to the level that it did with COVID, we're definitely not going to be able to. But I love that idea up front, and I definitely like the idea of making sure that we're very clear with where people can get wraparound services for support on our website. So we'll link those as well. Department of Human Services here, DHS, has a lot of that information available. So we'll make sure that's linked on our website. Thank you for that. And this is why I love these forums, because people bring such great ideas. Thanks, Keith. All right, working down the list. Any recommendations for cleaning to prevent exposure, household cleaners versus bleach versus cavity wipes? What is the testing, swabs, blood? Sorry if this was missed. So for prevention, the CDC does a great job of really addressing how people can make sure that they are engaging in prevention techniques. Again, unless you are overseeing like a large congregate setting, or like a school, or an old people's home or something like that, you really don't need to be overthinking this just in your house, for example, every day, unless you know someone or have been in contact with someone or live with someone who had monkeypox, right? So as far as home disinfection goes, there's a whole area on the CDC's website that talks about it, and talks about check that your product is EPA registered, and the EPA registration number is on the product. So that's linked from the website. And so it'll give you a list of different disinfectants in accordance with the manufacturer's instructions. And then it just talks about read the directions, pre-clean the surface. So make sure to wash the surface with soap and water if the directions mention pre-cleaning, or if the surface is visibly dirty, because dirt can keep the disinfectant from working. And then follow the contact time. So if the instructions say it should remain wet for X amount of time indicated to ensure that it's effective, utilize that. So again, the EPA, there's a link from the CDC, and I'm gonna ask my amazing team to put that in the chat. And that link, sorry, I can't do two things at once, even though I tell my husband I can all the time. So I'm gonna send this link to my folks to send to you. And so this link for you, Anonymous, so I can't bring you up, but for Anonymous, this link will help you with how you can link to all these EPA products. Let's keep moving.
So Dr.
We
Manning,
talked
there was
about
like,
oh, go ahead.
there was like 3 really good questions in here. Did we talk about what the incubation period after exposure?
Yeah, that was Nebu just covered that. So I saw that too, but it was linked to his question. So I love that people are asking that.
And then
You did do incubation with the isolation quarantine? No, I lied. Go ahead. I just realized I didn't hear him say that. Go ahead, Nebu.
So it's 5 to 14 days, which is really long, but it is what it is. So that is the amount of time it takes after exposure for you to start developing symptoms. So if you suspect an exposure, again, if it's confirmed, get vaccinated. If it's if you suspect it, like if you develop a rash and you're like, huh, is this something that could be monkeypox? Then you should think to yourself 5 to 14 days before your symptoms appear. Did I have a suspected or confirmed exposure? Is it possible for a person to have monkeypox but be asymptomatic and yet still be contagious? So right now, in the term of uncertainty, based on what we know, the answer is no. They think that asymptomatic transmission is highly unlikely because of the way this thing is transmitted. But I think to be safe, the official answer is it is possible 1 day before symptoms arise. That is both respiratory symptoms as well as solutions.
Thank you, Nebu. I'm going to read some fun chats because I'm tired and laughter is good for the soul. So Matt Haslam, you remember I tried to embarrass him and bring him up to the chat and unmute him. So this is why I love Matt. Matt sends in the Q&A, thanks, Dr. Mati, for the response. Sorry for not unmuting. My cat threw up right when you were talking. Commiserations to you and your lovely cat, and I hope the cat feels better, Matt. But thank you for sending us a message. An older woman, Christine Ingracia, an ally, a leader, a friend. Thank you. She says, thank you all for being so candid. This information is so important. Yay, people are finding this helpful. Another advocate, friend, mentor, Tanya Brown asked, I got a massage last week and wondered whether providers for those types of hands-on services are being reached for awareness about monkeypox symptoms. Tyrell, do you want to talk about this? And Tanya, just high five for always asking questions and giving us suggestions that I think are on point. So we've been really pointed about outreach endeavors, but I don't know honestly if we've thought about this specifically, and if not, I think it's brilliant. But Tyrell, thoughts about this?
Yes, it's really funny because I have a friend in Chicago that went to get their toes done, and they were like, Tyrell, I'm sitting here with some questions. And so I think I hadn't verbalized it yet, but I was like, I think we need to contact and kind of give that information out. And so I think every time we have these calls, I am always amazed at like the things that come back. And so I think that's definitely a thing that we can kind of get just information, because we, again, have been like driving to physical locations to like give information. So I can work with Valerie because I do think it's important that every entity that works in close contact with people needs, they need to have that information and be abreast of that. So we will definitely work on that.
Thank you, Tyrell. Natalie Flower, could you come up? And Nebu, I'm going to ask you to read and answer her question.
Hi, Natalie. Are you here yet?
Yeah, I am.
All right, go for it. Would you like to ask your question? And can you also please clarify if you are a healthcare worker?
Yeah, I'm an occupational therapist. I work at Barnes. So working close contact with patients, like some of the nurses we talk to in ICU settings across the hospital, folks that are from these different populations or folks that have these health disparities that are affecting their ability to receive care, coming in very close contact. And obviously from the pandemic and COVID, like we learned a lot about unknown exposures, finding out after the fact with testing. I just have a lot of anxiety about some of those things that happened in the past, where I'm finding out in 5 days, 10 days, that someone that I worked closely with was presenting with vague flu-like symptoms, and now they're being tested for monkeypox later down the line. And they're telling us that in theory, the isolation precautions are the same as COVID, but obviously we're taking those precautions with active COVID patients or patients being tested, but what is the right thing to do as far as wearing that more protective things just with everyone? It just doesn't seem like that message has yet gotten to the hospital systems. And I know that you guys work closely with WashU.
Yeah.
So I know that folks would be curious in the hospital system to hear like what the recommendations are, or what things we should be doing with every patient we encounter, with the chance that an encounter like this could come up.
Great question. First of all, thank you for what you do. We love ROTs.
We love our ROTs.
Yeah. So Natalie, we actually, both Valerie and I work pretty closely with all the IP teams at the major health system as well as the smaller clinics. In the short answer is the risk of transmission to healthcare workers is very, very low. And out of the cases that have been studied, it's, I think, like, and this isn't the only study, it's 1 in 5,500 some change was a healthcare related transmission, that there was a PPE breach. And I think, to answer your specific, and while you are 1 in a million, Natalie, it is it's not in this case. You know what I mean?
Yep.
Your specific question was around flu symptoms. So if someone presents with respiratory symptoms, I hope that they should be wearing a mask in a healthcare setting anyway. I know they for sure are at VJC, and this thing is not as transmissible as COVID, and it's droplet precaution. So like the mask, I'm going to get real technical for a second. It's source control, right? If they wear a mask, the chances of you being exposed to them are slim to none. Now, in settings where there is a rash, right? What we've instructed local healthcare providers to do is, if someone presents with a rash, room them immediately and have a provider go see the rash and either rule it out or test it for it. And when you go in the room, don proper PPE. So the only, again, we have yet to see healthcare worker transmission in the United States, to my knowledge, and PPE works in settings where they're testing for monkeypox. In your case, a mask will do wonders to prevent respiratory transmission. For every case in St. Louis, we do a case investigation. And healthcare, it goes sexual partners, household contacts, and healthcare workers. So if you come into contact with someone with monkeypox, I will know, and if there is a reason to get you vaccinated, we will vaccinate you. Does that answer your question, Natalie?
Yes, it does. I appreciate it.
Natalie, I also want you to know that I was on the phone with your head of infection prevention, and they're finalizing all of that information to be sent out. I actually think you guys have preliminary guidance out already, but I know that they're working to update that like now. So I'd actually invited them to join the panel and they couldn't make it, but we had that conversation as early today. So just wanted to reassure you.
I appreciate it. Thank
They're
you,
great
guys.
folks. Okay, light the chat up. Let us know if this has been helpful, not helpful, feedback. We'll always take encouragement and feedback here. So please light up the chat. There's still a couple more questions, but I just want to get that feedback from folks before everybody jumps off. And you can do it in the Q&A, sorry, because the chat is disabled. So in the Q&A, if you could just tell us, has this been helpful? How do you feel about it? Things you'd like different, all of that. So put that in the Q&A, please, just so we know how people felt about this tonight. So Kelsey, if you could come up, you've asked a really great questions. This is the last question actually I see for today, but Kelsey, if you could come up, and when I see you, I'll have you unmute so you can ask your question.
Yeah, I was just wondering, because we've been talking about how it's men having sex with men who are part of that vulnerable group. Does that, like, are we including like AMAB trans people in that risk group? And then if so, how are we going to include AMAB trans people in the vaccine efforts?
So I'm gonna go backwards. I'll ask Nebu to talk about the specific, what's happening around eligibility and risk for AMAB trans, for the AMAB trans community. And then I'll talk a little bit in general about the epi around this, because it's not great. And I'll be very forthcoming about that. But Nebu, do you want to talk about at least what's available and where they are in risk in prioritization for vaccine? And then I'll talk a little bit about the clear issues around data right now.
Yeah. Kelsey, are you the person that I spoke with earlier last week?
I am. I just came back to hear it again because I need to hear things twice. Nice to see you.
Nice to see you too. Look,
we love civically engaged people, so thank you.
Yeah, Kelsey and I had a lovely conversation. So for folks that don't know, Kelsey, do you want to explain what AMAB is?
Yeah, so AMAB is just shorthand for assigned male at birth. So that would include trans women, some non-binary identifying people, and gender non-conforming folks.
Thank you. So the best way to think about this is, it is quite difficult to walk the line between precise language and stigma here. So the truest version of who is most at risk is actually any individual that has sex with men who have sex with men. And trans folks fall under that umbrella. And therefore, if you go to the vaccine survey, they are more than eligible, and they are part of the priority, our prioritization. And I actually think I might have answered the question.
Yeah, you did. And I'll say though that I do want to advocate and be very clear that I believe that there has been woeful neglect, both nationally and globally, for data that honors our LGBTQIA+ community, but specifically our trans community. That when you don't have sufficient data, you can't protect people. I have a great friend, Dr. Corey Bradley. Anyone who follows me is tired of hearing me say it, but you're gonna hear it again. That data is justice, right? And because without complete and accurate data that really ask the right questions to honor communities, we can't get policy, we can't get funding, and that's how time and time again, our trans community, our minoritized communities, and our LGBTQIA+ communities do not get the support that they need because they're not even fairly represented in data. So I will say that we're making a lot of pushes for that at the national level, that we'll see a lot more data that's really specific about the wide variety and diversity of groups that are out there. But this is a limitation in the way that data is reported. So it makes it really difficult for us to give you a really true and representative depiction of the risk specifically in the trans community. Does that help?
It does, yeah. I was just thinking, like, Tower Grove Pride is coming up in September, and
yeah,
I volunteer with Squish, and I think we have a table. So maybe I'll print off some of your flyers and put them on.
That's what I want to hear. Let me tell you something, Kelsey. Let me.
We can do one even better, Chelsea. We can bring you some.
Let me put Kelsey on the spot. But Valerie, do we not stand a community partner that will say, hey, health department, we're going to come to you to be a partner.
Yes. We're
going to go to your website and download from your site. But we'll also invite you to make a table, because that's what Valerie and her crew does. They're the best in the game, and they will come up with the most vibrant, amazing table you've ever seen and work with the community. But please also invite me. Like, I know I'm a new health director, but I don't get invited to these cool events, and I definitely want to show up to Tower Grove Pride. I think that would be incredible.
I don't know about you. Valerie and I were hanging out at Pride St. Louis. So
yes. Listen.
Right,
one of my babies had COVID, and I was so mad I couldn't be there. But way to try to put me on the spot. Maybe it was like, we were at Pride. Where were you? And I gotta put my baby's health all on the spot.
I do want to say though, the city table is pretty great. I was like, okay, I had some ideas. They got the music, great.
Listen, the city's table is
the city table is great. Yeah, no. We now know, we are now prepping based on the city table.
See?
We're getting a lot of great feedback.
You can always get flyers.
What did you say, Valerie? Go ahead.
Kelsey, you can reach out to myself or Tyrell. And then we can get those pamphlets and flyers for you. You can put them on your table, so you don't have to print them yourself. You can come to us and we can get them for you too. So we'll be happy to come out there.
That would be really great, because we rely a lot on like student print quotas to print our stuff.
Kelsey. We're printing machines. We'll have them in English and Spanish for you, and we're trying to expand to other languages because we know the need is great. So I'm going to wind down. We did a great hour and a half plus 4 minutes. We got to most of the questions, I think only maybe 1 or 2 towards the end, and I'm really appreciative. We got a lot of great feedback. Thank you to everyone for being so positive, respectful. It was great dialogue. I'm so happy. And I want to say in closing, if you have any questions in the future, please call the Department of Health hotline or email us. Our phone number is 314-657-1499. You can email us at health@stlouis-mo.gov, and it should be on the screen in front of you. Yes, it is. You can follow us on all our social media platforms. The handle is the same across Facebook, Twitter, Instagram. I'm too old, so I haven't gotten us on TikTok yet, but maybe we're going to get an intern that will make us hip with all the things the youngins are doing. But our handle on all on those 3 are @City of STL DOH, and of course follow us. Please go to our website for all the up-to-date monkeypox information. Soon you'll be seeing a data place. I mean, we don't have that many cases to have a true dashboard. The county has done a great job and has developed one. We'll be doing, we're gonna have ours in alignment with theirs. And I'm gonna add more resources based on the feedback today for how people can get support. But thank you, everyone. The comments are fantastic. This has been so helpful, exclamation mark. Thanks for this town hall. It has been extremely helpful, most appreciated. I feel more equipped than an hour ago. I love that feedback, very helpful, thank you. My husband even was on here trying to support, thank you, Jesse. We're getting a lot of feedback from KMOX, extremely helpful to get the information out to the people. I want to see that in print, Maria. It's not real until you put it in print. And then awesome, engaging, learning, informational session. I look forward to participating in more sessions like this. Thank you all so much. We will do this again as the public needs. We will have this recording available for both the city and the county's websites. Please email us and contact us, hold us accountable, but more importantly, be an active partner, be a part of the solution, and help us to help our communities. Thanks, everybody. Good night.